Let me once again welcome everyone to our webinar on facilitating technology innovation in human services. Today's event is co-sponsored by Freedman Consulting, the American Public Human Services Association, the National Governors Association, and the Government Innovators Network at Harvard Kennedy School's Ash Center for Democratic Governance and Innovation. Our moderators are Stephen Goldsmith, Daniel Paul Professor of the Practice of Government and the Director of the Innovations in American Government Program at Harvard Kennedy School. Steve is starting us off today.
Thanks very much, and thanks for joining us. This is Steve Goldsmith. I'm a professor at Harvard and Director of the Innovations in American Government Program, and from time to time, we do webinars on important issues, and we're particularly the help of Freedman Consulting and the American Public Human Services Association, bringing together a great audience and great speakers. A comment or two. I mean, everybody on the phone knows that agencies or officials, government employees, nonprofit workers are facing very complicated issues today, service delivery, that everyone recognizes, of course, that the problems by these agencies are system issues, and that old thinking of operating through the window of a single agency or a single manifestation of a system problem is a pretty narrow way to proceed. We're all painfully aware of the number of high-counted public officials who find themselves caught either legislative crossfire or media crossfire about diseases that happen their watch. So in this period of substantial difficulty and substantial tension and complications, we have probably the most important transformative set of technology tools ever, literally ever, to kind of cross the field of public service. And today, we have leaders in those areas to talk to us about, how can we leverage technology innovation to solve what look to be intractable problems, provide information, decision support tools to the workers who are on the front line, to manage the accountability of those workers and their results better, to hold providers more accountable, make life simpler for the beneficiaries of our services. It's a great, terrific time for some of the country's best in this area to share their experiences with us. So, before we get started, let me ask Sam Gill of Freedman Consulting to say a few words about an important report that they have recently done that serves as the foundation for today's webinar. Sam?
Thank you so much, Steve. I really appreciate it, and thank you to all of you for joining. We're really delighted to be partnering with the Ash Center and also with APHSA and NGA in putting on this important conversation. Freedman Consulting is a strategic consulting firm in Washington, and we work on a range of issues related to human services, but also other key policy areas. And this work report that Steve alluded to, which is being released at the conclusion of this webinar and will be available on the Data Smart Cities website, is entitled Gaining Ground. And it's an effort to understand both the opportunities that technology presents for human services agencies, the role that technology can play in these agencies, but also some of the common challenges and strategies to address those challenges that state and local government can use and have used successfully in order to take advantage of technology. This was supported by the Ford Foundation, which has a long history of investing in different kinds of programs to improve access to benefits and to improve the administration of human services. And what we did for this report was we spoke to over 100 people nationwide and profiled in particular 11 different sites, including New York City and Montgomery County, Maryland, which you'll be hearing from on this call. And our effort was really to hear directly from many of your peer stakeholders about how they decided to undertake innovative technology projects within the context of human services administration and public benefits, and what some of the challenges were that they encountered, and then what it was that they did to overcome those challenges. And there's no question that this is an incredibly difficult thing in many contexts for state and local government to undertake, but something we heard nearly unanimously is that the right investment in technology is very much worth the time and material resources required. So we really look forward to today's conversation. We hope that it catalyzes ongoing conversation. And again, the report, which is entitled Gaining Ground, will be available on the Data Smart Cities website. So thank you very much, Steve.
Our first speaker, Gibbs, who currently is a principal at Bloomberg Associates and as New York City's Deputy Mayor of Health and Human Services from 2005 to 2013, supervising the vast array of New York City human service, public health, social justice agencies, active in spearheading a range of innovative initiatives, CEO Fund, the SAC bonds, the Young Men's Initiative, and on and on. But for purposes of today's conversation, we're emphasizing Linda's leadership in the use of data and technology in services, improve contract effectiveness, as well as evidence-based programming. So with that, Linda Gibbs.
Great. Thank you, Steve. So now, I'm 3 months out of city government, and so my comments today are now reflecting back on the work that I did. But I know that we have on, as participants on the call, the two folks who are continuing to lead this work in New York City, who are Ivy Poole for HHS Connect and Dan Simon for HHS Accelerator. And the really encouraging sign to me is that this work is being fully embraced and continued under the new administration. So I think, maybe to start with a lesson at the end, which is that if you build this kind of stuff and it has use and purpose for all of the folks who are working in the social service system, they're going to be an ease to continue it and to shape it for the next administration following. And so my experience, I became the secretary, I'm already confusing, so I became the deputy mayor for Health and Human Services in the second term of the Bloomberg administration. It gave me an opportunity to convene the agencies who had been talking about but not quite frankly, we were frustrated by and not successful in figuring out ways to help our agencies do a more coordinated service delivery. And so first term, we about 10 agencies gathered together and said, we want to overcome this challenge that we have of having our frontline workers not able to coordinate their knowledge about clients that they're working with shared, and being able to most effectively plan the services for them because they lack the ability to sort of get there and do that kind of joint planning. So our grand vision was that we wanted to have joint case planning and management among our frontline workers. And ultimately, we stumbled on that goal because we couldn't figure out a way in real time to have the workers connect to each other, to even know that they were present in the client's life. And so what we did is we wound up taking a step backwards and say, okay, we need to this is the moment where we're going to all put our narrow agency self-interest aside, and we're going to invest in a collective shared interest of combining our data systems so that we could maximize the potential to do that kind of shared planning. So this is the perennial problem that many agencies have, and in fact, as a commissioner of an agency, I see this as a problem of the divisions of a single agency. And the approach that we took, two separate solutions. One was that shared case management, and this we call DHHS Connect, and which is essentially a federation of very numerous data systems. Rather than replacing all those systems with a new single system, what we did was we created middleware to connect the pre-existing systems together. So it didn't necessitate a whole replacement. It was just really building the connectors between very old systems, very new systems, and creating a foundation for connecting additional systems moving forward. And the second challenge, which came second chronologically and really spurred on by the impact of the recession on the strength of the nonprofit community in New York City, it was, another one of those moments where we said, okay, now it's time. Let's get over this this long-standing issue we have, of multiple agency programs, and every single one of them has their own separate procurement, separate RFPs, separate contracts, where we had multiple nonprofits holding, in some cases, dozens of contracts with the city. Let's use a technology approach, again, that would help to streamline and simplify the procurement process in order to make, give our agencies the time and space to do the work that they're expert at doing, instead of being project managers, and our nonprofit organizations free up their time and energy away from the procurement process with a simplified RFP. Looking at Connect first, it's interesting because the where we started was in this left quadrant, where we were focused on our workers. And last bullet there, if you want to think about our window into why were we going to do this coordinated IT systems, it was really around collaborative case management. As we started to put it together and think about how to get everybody on board, because the implications were through, and the opportunities were throughout, we really refined our thinking to say, okay, there are many partners that we're going to need at the table to participate to make this successful, but there's also many beneficiaries. And so we worked out these various aspects of the system to think of what are the capabilities we wanted it to have. On the side, it was a chance to think about how can we actually streamline life for clients so that they can access services online through a single portal and a single client record, so that every time they approach government for a service, they wouldn't have to go through the rigmarole of providing all of that background information over and over again. But also, when they approach the government, they would have the benefit of accessing documents that pre-exist and are available in other agencies to simplify their application process, for that next time they need to get the support of government. In New York City, we have, dozens and dozens of nonprofit providers, some as small as, providing one service to one agency, others that are more comprehensive than even city government, because they have services beyond what the government pays for. And for them, we were both looking to improve the efficiencies of their operations and their own ability to do coordinated casework, but also to allow them to spend more time on those services and maximizing their knowledge around clients and client services. And in fact, most of the frontline work, contact work in the city is done via the providers through contracts and less so by agency staff. Down on the agency side, the work in New York City in the nonprofit world is very much about expert contract management, and we're so good at it that we like to come up with newer and newer iterations. Every time you turn around, yet a new outcome performance standard, yet a new data tracking system, and we were driving nonprofits crazy. And for every new idea, there was a new tracking sheet, and the providers were getting, and the frontline workers were getting stuck at their desks more and more, just filling out forms for us in different systems, and this completion, rather than making life simpler and easier, was actually burdening them more with data, the filling out all the paperwork. And so part of what we wanted to do was to think about how could we relieve that burden on the providers, but increase skills of the agency staff around outcome-based performance and getting to a set of outcomes and indicators and consistent reporting across programs to simplify the knowledge, but to improve the ability then to leverage improved performance. Circling right back to the workers again, giving them the tools that they needed in order to do a better job when that next client appeared on the frontline workers' caseload. ACTS NYC is that the client portal. It does several things. I would call this in its initial stages. And we built the capacity, but it hasn't been maxed out to any degree in terms of what it has the potential to do. Right now, we've got over 30 city, state, and federal benefit programs that you can put in all of your household information, and then you can learn about what you're definitely eligible for, what you might be eligible for, what you're definitely not eligible for. And increasingly, we're adding more programs to be online applications, so not just a benefit screener, but an actual, you fill out and then you hit send, and it goes to the agency to verify eligibility. That capacity, the promise moving forward now with the new administration in New York is to take that Access NYC through ARA, and they're looking at building increased sort of virtual office reengineering using Access NYC as the platform. In Worker Connect, this is where basically, and maybe to say a word, biggest issues is the client confidentiality and the shared access to data. And for a long time, the disagreements, lack of clarity, caution of lawyers was an impediment for anything going forward. And the way that we structured this system, it's a complete federation of the data, meaning the synapses connect all the totality of the data systems. But the the user groups are very carefully defined user groups, and they have access to only that data which they have a legal right to have access to. And so each user group is defined very clearly. The basis of their need for the information is established. The legal authority to see that information is established. And then basically the door opened to that data for to have legal access to. And so the way that we started this was really a low-hanging fruit approach. Let's take the stuff where there's easy consensus that is clearly shareable information. And then we move from there and working closely with the attorneys in the various divisions to have everybody just develop a level of comfort and support. So a number of different useful things, some of the most, quite frankly, things around preventing foster care placements for children, because the federated data system was allowed us to find potential placements for children with family and in fact oftentimes with fathers who weren't aware of what was going on in the child's household. Diversion from the homeless system by reaching other family members who would offer help and assistance. On sort of the fiscal conscious side, Medicaid eligibility for HHC reimbursement, where uninsured individuals coming in for services didn't want to stick around at 4 in the morning to fill out the paperwork for eligibility, and would allow the HHA fiscal office to establish that and follow up with them. And this slide shows some of those existing uses that are already being made at the user groups across the top there. Some of our biggest challenges, the next frontier that's being worked on there, is to bring our education data in. That was called for more than any other data source, as what people, the workers of all these different systems, wanted to see as a critical piece of improving their services. And so we're working closely with the Department of Education and are very and maybe can update us in the chat room about how close she is on that. But there is really great progress on getting the education data in. The second project is the Accelerator project, and this is I love this. It basically says, we have 220 separate programs across 11 medical agencies, and every one of them had a separate contract for their services. And so you'd get an employment provider who might have to contract with 6 or 7 agencies in order to draw down the funds in order to provide the services for their expertise. And the RFP process from issuance of RFP through competition and selection and contract award could take over 15 months. Quite frankly, 15 months was quick. When the Great Recession hit, the nonprofits were so strained, and it was just a moment in time where we said, okay, let's stop this craziness. We can do our job. We can come up with a simple and more streamlined fashion of contracting with our nonprofit partners. And this is where we created an HHS accelerator, and the big concept is a centralized team of procurement individuals who manage the Health and Human Service procurement that are in the mayor's office. That included both procurement experts, but also had a strong capacity around financial management, technology, data and analytics, but who had a foothold in the human services, so new program and policy as well. But in a centralized team of experts, a rule change that allowed us to have a single procurement that would establish a base relationship with a nonprofit seeking to do business with the city, regardless of where that work is. And the IT piece was an online system where all of the background documents needed in order to do business with the city, all the business stuff, those things that get submitted in triplicate for every RFP, could instead be registered in a data vault that would be automated and alert the nonprofit that of the dozens of documents that need to be established, which ones are about to expire. So an alert system where their vault will say, hey, in 2 months, your audit document expires, get new audits in, so that you maintain, once you get a standard master contract with the city and a perpetual updating of that contract based on these alerts of the data vault to keep you in good standing. And then once you have that master contract is perpetually in place, and all that has to happen for the city to procure services, the agency side, the agency staff does scope of work that is about the business, the work that they want to see done, and the nonprofits at that point simply have to write a response to, here is how we would bring our expertise to provide that service. And all the rigmarole around, all those background documents and contracting and everything is already in place. So the transaction is simply about the business. And so this system is last July were the first contracts that were awarded against this system, and amen, hallelujah, it worked, which is always for these IT systems. You're always in incredible, panic attack about whether or not they'll actually work for you. And Dan Simon and his team at Accelerate has just issued a very large contract. This is of significant size, and so didn't work only for a small contract, but is also working for very large procurements as well. So key lessons from this on the last slide. Able to do this because I think of those agencies coming together at the beginning, wanting to do that shared case management and feeling frustrated that we didn't have the tools to do it. And so we were willing to, as commissioners, set our own desire to control our own IT systems aside for this joint cause of more comprehensive and effective services. We obtained an executive steering committee of those 10 agencies and added on in order to learn the process moving forward. And we had really good staff that was doing the work, who were very responsive and tended to the needs of the executive steering committee and had the expertise and could really navigate all these issues, technology, program, legal, and quite frankly, making things happen in city government. And we were pretty pragmatic about picking the easy stuff first and trying to win some simpler things and build the foundation, and then sort of expand from there.
Thanks, Linda. Speaker, but let me ask you a quick question first. So, how do you feel right word would be, knowledge gap between the software experts and the technology experts, right, where you may hear an answer, or the lawyers, right, where either the latter two categories are busy telling you what you can't do, right? So how did you manage to develop a solution, put just and lawyers to get to the right answer?
On the technology side, I had a few different experiences. I found two things, and they are unique sort of strengths. One was to get off the ground. Brought over a Kamal Barwani, who was the CIO at the Department of Health and had already had experience working within the city government, and so he was expert at technology, but he was embedded in an agency and had a proven track record of being able to build the system, and quite frankly, he cared deeply actually on the sort of the brainstorming, road mapping group when we were saying, what should this Connect thing look like, and I was impressed by his commitment to the shared mission. He was very driven by a commitment to making our social service system work more effectively for clients, and so he had all of those experiences. His ultimate successor before Dan and Ivy, Louisa Chafee, is almost a little bit the opposite experience, more historically embedded in social service delivery, but had this incredible ability to understand IT talk, which I never quite frankly ever became expert in, but she mastered it, and she'd mastered the IT procurement process, and so her foothold was in the social services, but she adopted the other. I've seen less success in other examples, bringing IT people from the outside who didn't know government or services, as committed as they were to the cause. Very difficult to pick that up. So that was my particular experience. I know that there are other examples where there have been successes. With the lawyers, parents, there's a lot of myths about what the confidentiality rules prohibit. And there's an inherent caution. The lawyer's job is to protect you from lawsuits, so it's a lot easier to say don't do anything because that'll guarantee no lawsuit than it is to be willing to sort of push and test the opportunities and find out where those either exceptions or rules are. And sometimes it can just be a lot of the siloed behavior and willingness and intransigence can just hide behind legal prohibitions that don't exist. And so it was hiring our own lawyer whose job it was to muscle through the confidentiality issues and just perseverance and keeping people at the table and having, sort of forcing them to explain why not. And that engagement with, some of the most resistant camps on confidentiality issues have wound up becoming real advocates for this work.
Each success makes it a little easier for the next person, so thanks. Next, we're going to hear from Ahluwalia, and the director of Montgomery County, Maryland's Department of Health and Human Services, a large agency, 1,600 employees, $250 million budget, faced with increasing caseloads and all of the problems that other urban counties face, who's used a nice variety of technology tools to assist her work as well. So, please.
Great, much. Hello, everyone. What I'm going to do is, can I move the cursor? Is that move, or you'll move them for me? I forgot.
If you could just click on the slide with your cursor and then use your arrow keys to advance the slides, that would be great.
Okay, super. I figured it out. Thanks so much. So just a little bit about our county. We're a county of about 1 million residents just outside of Washington, D.C. We are historically a bedroom community for the federal government. Very significant demographic shifts over the last 10 or so years. Our population is now 32% foreign-born. Just in the last census, we actually crossed the 50% mark, like minority composition of our county. Significant growth rate in seniors, significant growth in our child population. The enrollment in the school system continues to grow, with English language learners in particular. 50,000 students in our school system are reduced meal eligible, which actually speaks to a growth in poverty in our county, which has actually been a very wealthy community. During the recession, mapped out actually 6 zip codes of extreme need where poverty was on the rise. Integration, if you will, is best made in this next data point. Over 120,000 households were served in fiscal year 2012, and a third of those households use more than 2 services from the department. So domestic violence, special needs housing, maybe maternal and child health, it could be behavioral health. So a very crucial need to collaborate across programmatic silos. As Steve said, we have 1,600 employees. Our caseloads have continued to grow. The big growth for us in our suburban community has been in SNAP. It's a 166% growth rate. And we have a county program that serves uninsured residents, and so we serve about 32,000 without health insurance, another 1,600 women who are pregnant and without health insurance, and there's another program that serves about 3,500 kids without health insurance. So a very large investment of county general funds into the health and well-being of our residents. The department itself is organized with one director and centralized administrative functions, and we're moving now that we have funding for our technology innovation towards single client record supported by an interoperable database, a uniform intake form to identify all service needs upstream. So at the point of intake, there's a screening tool that has a scoring methodology attached to it that then determines acuity, and in real time wrapping services across the health and human services enterprise around clients who may have a need for it. Chartered as this integrated entity back in 1994, the entire HS enterprise was designated as a HIPAA-covered entity. Included social services as well as income support programs, and it's been really very helpful to have that sort of designation as we move towards a more integrated and interoperable frame. So building an integrated service delivery system for us, we've got the front door, which is no wrong door. How do you then take in intake, screening up front as to what people might need? We've mapped out entirely the entire business process for building this new technology system. The deep end, which is 20% of our clients who are using 80% of our resources, we've also figured out a business model for integrating those services and actually staffing those services with facilitators to ensure that those clients are stabilized and then moving forward, spiraling up, as we call it, as opposed to recidivating back into the system. And are using our technology frame to fit the integration means in the middle, which is the 80% of our clients who are using about 20% of our resources. But there's a profile amongst them who have the potential to become more deepened, and as we keep moving our casework practice upstream towards prevention, figuring out to overload the resources more towards the front end as opposed to the back end as it is today. Building an integrated service delivery system for us has meant a series of activities and tasks that fall into these 4 buckets: practice, policy, people, and infrastructure. Practice for us is building the integrated intake, developing the triage and assessment protocols, integrated case planning, the service delivery, and then the analytics. From perspective, we've spent a lot of time on confidentiality and privacy and sharing of information, the ethics around who gets what service, the provision of services, what happens when a client is non-compliant in the program A, not so much in program B, what happens this resolution if there's conflict between child welfare practice and homelessness around or domestic violence, right? So what are those protocols and how do we sort those things out? Equity is an important value principle, especially given how diverse our community is. And lots of other things like issues like case ownership. Who owns the case when it's an integrated case practice environment with an integrated case plan? How do we drive the distribution in those circumstances and things like that? Full emphasis on training and the tools that are needed to do this, accountability. The three types of evaluation really are the services working at the client level, happening at the systems level, and then what's happening at the population level. Make sure that the community as a whole is experiencing impact of these improvements. Originally building an interoperable technology system, we implemented something called a quality service review, which helps us actually qualitatively impact the benefit impact of an integrated service model. So it says, and of course, this bucket of human services contracting, which is really quite complicated, cumbersome, doing a lot of work with our new emerging nonprofits who often tend to be from these minority communities and how to deal with and manage public sector contracting. From a modernization standpoint, we built our integrated case practice model. We did business processes and mapped business flow. We built this enterprise-wide client view. So if you look in the system, you could see, is she getting food stamps? Is she in homelessness? Does she have child welfare contact or mental health contact? What's going on? Tracking of improved outcomes and, of course, analytics that will take us all the way up to a population health level. Drivers for us to do all of this in the last several years, it's the change in service delivery from a best practices perspective. The Affordable Care Act has been a huge lever for us. We've exercised it fully. The difficulty and the cost in maintaining one-off applications and the efficiencies from using multiple state systems. Of course, goals are to improve client outcomes, reduce overall cost of treatment, establish a single platform for service delivery, prepare changes that the ACA is mandating, and then simplify ongoing application maintenance for us. And the vision of an integrated HHS, I kind of joke with my boss. He said to me when he interviewed me, well, what's the point of an integrated HHS other than to create this huge bureaucracy? And the vision is integrated HHS will add value to the customer, right? They tell the story over and over again. They want to apply for services at different locations and have a Rolodex full of case managers and nurse managers who are providing services to them. So no matter which of these doors the client came in through, aging and disabilities, behavioral health, children, youth and families, public health, special needs housing, they open that door and each of those doors and connects it to the services that are needed and run in a way that would prevent them from stabilizing or penetrating deeper into more more expensive treatment services. So we're in the process of implementing an enterprise-wide integrated case management system, enterprise content management system, which would be your digitized records and electronic health record that improves their ability to respond to the Affordable Care Act and a lot of the billing issues that are related to that. They're definitely going to see, already seeing a reduction in grants because there's an expectation that we would then be billing for many of these services. I just want to touch briefly on information because this, without confidentiality and privacy issues being resolved, it's really very difficult to operate or to share information or to case plan together. So these are sort of some core principles, right? The policy and the practice of integration underpin approach to sharing of information. Business processes that we're building support the sharing of information. which is on need-to-know role-based access basis, and there is a balance between interoperability, data sharing, and guarding against breaches. Really adopted a opt-out approach. So if somebody's being served by the department and they're getting multiple services, we can then let them know that we will be sharing the information for purposes of treatment, their vision and HIPAA that allows and other ancillary services to be included in such as income supports, we believe, and social services. So we've used that provision. Substance abuse, of course, continue a little bit more difficult. 42 CFR is not as nimble, even for purposes of treatment, to share information. So integrate data, again, 30% of our clients are using multiple services. Clients have to tell their story multiple times. Data has to be entered multiple times, which increases the risk of the retelling and the re-entering. Without a master client index, it's really hard to tell what services a client is getting across our enterprise, and often services are duplicated. So a child welfare worker may be looking for housing, a family, and the mom may have on her own gone to the homelessness side of the house looking for housing, and there are two sets of resources being deployed to help this mom, and with better coordination, you can really create greater efficiencies. We use data so that it is not necessary to either re-enter or to have the client retell their story, traumatic as it is, over and over again. So learned, I think, no question, contracting is painful and time-consuming, and so here's an interesting example, right? We had to do our electronic health record contract. It's a fractional piece, right? We get 29 cents for each claim that gets submitted or in a bill that gets submitted to the insurance company. We wanted to start that small, so we were trying to let out a $9,999 contract while we were doing this bigger competitive process just to get us started. Because it is PII and personal health information data that's exchanging, the legal advice that came back to us was that we needed to have very high liability ratio. The industry standard for a transaction contract like that would be 2 times the value of the contract. And so trying to sort out what's the risk, what contract are we talking about, how much money does it, everybody's very well-intentioned in the space, but trying to figure out, you cannot expect someone to come in with a $3 million insurance on a $10,000 contract. And so the sort of set of purchases to work through. Management is deep, difficult work, especially when there are 4 generations of employees in our workflows. We have the boomers, we have the Xers, the Yers, and the millennials, and all 4 of them have very different requirements. And so trying to, and we know we're going to see a retirements as the new system that comes on. Communicate. It's the only way to really manage the change. We have strategic alignment with our public and private partners as we're making all these transitions. And the important thing, I think, and this is harder in more mature organizations. I've worked in consent decree organizations and in mature organizations. The resilience to change and to transitions is greater in the decree organizations than it is in mature organizations, such as the one I'm working in right now. People just believe that things are not broken. So why go through all this pain to try to change and modernize when things are fairly, averagely well or above average, even in terms of performance? So, lots in there to continue to work with. I think that is my last slide. So happy to respond to the questions later, and I'll hand the mic to you guys.
We're going to encourage people to continue to post their questions onto the Q&A tab, and after the next speaker, we'll go to them. But just really quickly, though, before we do the next speaker, Umi got a content management system, and we got a couple questions. I was thinking about this as well. Right? You can systems as middleware to extract data out of diverse content management systems, Child Protective Service, health records, and then analyze those and then mine that data for purposes of assisting field workers with decisions. And you can you can do the data in one system, right? So when you talk about content management, is totally different benefit systems in the content management system, or is it extracted from the relevant content management system and made more through middleware and a front end?
The latter. So there are two different things. One is put the data from multiple systems, because we have about 100 different databases and systems right now, several local, and in this large integrated department. And to bring that down to about under 20, which should be a huge accomplishment for us, under 10 if we can pull it off. So it is to extract data from multiple systems, but it's also, the other piece of this is attaching court records and verification information, income verification, birth certificates, so that it will sit in a repository, a vault, if you will, from where it can be extracted. So it's both, and there will be a central repository into which, going forward, all documents can be stored and retrieved by staff. So that we're not requiring the clients to resubmit, and there's less chance of losing documents and things like that plague this system right now. And it is, the data itself is extracted from multiple sources. What we're doing, though, is we're mapping the data elements that we actually need. So for right now, we will code somebody as African American, but or Black, right? That's a very big box. To that are continental Africans, Caribbeans, and African Americans, and each of those communities has very different needs and experiences in terms of access to services and their service experience. And so we really are trying to become more granular in the elements that we're teasing out in creating a master face sheet for all clients who are served by the department.
Good. We'll probably come back to this in the questions and answers. I just want to turn over to Anita Light, the Executive Director of the American Public Human Services Association, who has a lot of these issues across the country and heads a national working group on integration and initiative that focuses on integration. So, Anita.
Steve, and thanks to Sam and Kara for inviting APHSA to be on the panel today. We have been working with members for several years now on implementing technology solutions in human services, and I'm really pleased to be able to share the context of that work with you today. We have been, over the last several years, working in our Pathways initiative, and within the body of work is our Shared Future State, our vision for a transformed human services system. And many of the things that Linda and Uma have talked about today are outlined in this particular vision. They've both talked about being person and family centered and being outcomes focused in the work that they have been doing. Really highlighted the need for integration and alignment between programs and infrastructure. Linda particularly addressed a new business model that they have, the different components that they've addressed within the work that they have done at DHHS Connect and the Accelerator. And I'm not going to go into details on the business model piece today. It really is a great reflection of that work. As you heard from Uma, using data, sharing data, being able to do analytics that are so critical for decision making on services for children, adults, and families. The integration of that data is also part of this vision. Certainly, looking at the flexible mechanisms and ultimately how human services is accountable for the resources that they receive are all part of that vision. And again, both and Uma demonstrated that in an excellent way as they described their work. So our Pathways initiative, we have, of course, focused on how to operationalize this vision, and certainly that is a challenge in and of itself. But what we have used as one of our for this work is here in the Human Services Value Curve. This is a work that we have been using for the last 4 years with the developer of this particular model, Antonio Oftelli, who is the director at the Leadership for a Networked World out of the Technology and Entrepreneurship Center at Harvard. APHS has been annually meeting at the Human Services Summit, and we've used the Human Services Value Curve to be our guide as we look to analyze our vision for human services. And as you can see, what we really hope for our human services organizations is that they move from a regulative business model through the different phases of development to a point where they are generative in nature, moving from that regulative output-based environment, generative in nature, seeing how they organizations can engage their clients in different ways, stakeholders and community partners in developing the solutions that can address the multidimensional family and socioeconomic challenges that they face as they do their work. We looked at the services value curve, and we realized that members really want is a step-by-step process of how to move from the regulative business model through the collaborative business model, integrative, and up to the generative, a helpful step-by-step process. And in order to do the process, what we did through our National Work Group on Integration is to take the value curve, use it as a framework of thinking about a developmental trajectory, created a self-assessment tool to really look at the level of integration, which is a critical component of that of the modern human services system, to let us have a landscape view of what integration looks like across this country. And while Uma and Linda are certainly models for what the human services system can and should be doing and operating in certain ways, it's not necessarily the case across the country. We have several organizations that have demonstrated a regulative position within their organization, but generally speaking, what we found across the country is that most organizations are at the end of a collaborative level of performance in terms of this particular value curve. Some information that we gleaned from our self-assessment is found on these 5 bullets. The challenges that organizations face in terms of implementing any type of innovative technology and moving their organization to an integrated has to do, first of all, with operationalizing the vision. What we found in our self-assessment is that the leaders in this country over human services are very, very clear about what they want their organization to do and to be on behalf of children, adults, and families, and have done a really good job of sharing that vision within their organization and within their community. The problem that was identified in the self-assessment is that unlike experience, and in the case of the HHS Connect, there's a huge problem in operationalizing that and making a reality for human services. Another issue that was identified as a challenge for implementing innovative technology had to do with how that human service organizations were having problems tracking and updating their internal business processes and procedures, and therefore whatever technology that they had implemented within their organization not have the accompanying processes and procedures, so to speak, in order to make effective use of that technology. Another issue that was identified had to do with a changing need for different competencies and skills in a modern, technologically focused environment, and how human services needs to look at purposing some of the workforce that they currently have and changing the kind of work that they're doing in order to take advantage of the technological advances that are available to them, and then how to, when hiring, look for a different set of skills that are necessary for the 21st century. Another issue that was identified, and one thing that quite a bit about, is the integrating service delivery, and that organizations certainly have done a lot of work advancing client access to benefits and services. The actual operation of those services and the delivery of those integrated services are lagging somewhat. And the last thing that was identified in the self-assessment had to do with human services and ability to develop outcomes that are relevant to the work that they're doing, and then the associated outcome measures that need to be act in order to determine success along that integration continuum. So, one of the things that we did as a result of this national self-assessment was to interview our members, similar to Sam described the work they did in his report. We talked to a variety of our stakeholders, our members, thought leaders around strategies to be employed in order to address the challenges that we were uncovering in our self-assessment. And the recommendations include these pieces here. One of the issues that's large is the need for the leadership in human services to demonstrate adaptive leadership skills, being able to anticipate what's coming down the pike, using their best information to look at those trends and then make decisions that are going to be in the best interest of those being served. Really being able to understand what's going on in their community and within their organization to determine how to advance that, and then respond nimbly and quickly and flexibly to those challenges, and if necessary to hone in on being disruptive and changing totally the way that you're doing business. And I think just listening to how Uma described the work done in Montgomery County, she really has been transforming that human services system. It does definitely look very different than it did even 5 years ago. One of the other things that she pointed out, and of course is certainly something that HHSA is very focused on, is change management and how necessarily pay as much attention to the actual change management process as good when implementing new technology, implementing a new practice, or changing any type of internal business processes, that there really needs to be a sound change management structure and process getting this work done. And frequently, that very structured and systematic approach is lacking in organizations. Another strategy that was highlighted in our conversations had to do with the need for human services agencies to focus in on project management process itself, and particularly when planning and looking for implementing technology solutions, that the internal staff need to be just as focused on the project management of that implementation as those contractors are that have their own internal project management process going on. Another piece that was really loomed large for me, listening to both Uma and Linda, had to do with how they address their internal business processes. And of course, frequently in human services agencies, that work is not necessarily what we've been doing in the past. So looking at how workforce needs to improve or change and add to their skill, honing in on these three: change management, project management, and examining business process engineering, are very critical to modernizing the human services system. And then the strategy that was highlighted in our conversations had to do with how to really examine the partnerships that you currently have, both internal to your organization, certainly looking across different agencies, different departments, and how you can bring those players to the table for an integrated approach to human services. Looking at how you or align your own strategies with another partner organization, and then look at how you can maximize and move forward on your partnerships that are going to be in the best interest of children, families, and adults. So we've developed here at APHSA several, we are working on a document that has several components to it. It is our transformation toolkit, and we'll be looking to share some of the highlights of that document for membership, and we'd be happy to talk with anyone on the call about what's in that toolkit that can address some of these strategies that are designed to address the challenges that we identified in our self-assessment. With that, Steve, I'll stop and be happy to entertain any questions about some of the work that we've done through our national work group on integration and some of the tools and toolkits that we've developed.
Good. Let's each of our panelists, let me summarize two or three of the questions and ask you in the same order to respond relatively briefly, if you would. So, these are dominated by federal, state grant programs and information controls and the like. And I know when Indiana did its casebook work with Annie Casey for Frontlines, it essentially paid for the work with state dollars because the reimbursement process was complicated. So, and I know, Linda, you've had issues. New York City traditionally has had issues with state information systems being very difficult to manipulate, if you will. So, question for each of you: what are the federal and state obstacles or opportunities, and does that affect both funding and authority? Let's start with Linda.
Yeah. In New York, we basically we did our own, meaning that we didn't look for state permissions or federal permissions. So we did what we could that didn't require that, and that really goes back to the lesson of, sort of low-hanging fruit, get started where you can. It did mean a little bit of a frustration because there are critical data sources that are state-controlled records, and so what allowed was some feeding in but not full integration, for instance, with the child welfare data systems. But it did allow the frontline workers in child welfare who were seeing their full system have the benefit of reaching the Connect system for information about their clients. So they could sort of patch it together themselves, but the information could not flow in the other direction. And that was really, we were able to put together resources, and those were just tougher battles to tackle, quite frankly. I'm very hopeful. Louisa Chafee has gone up to be the Deputy Secretary for Health and Human Services for Governor Cuomo, and she continues to work on these issues. Actually, Deputy Secretary for IT for the state as well, and so I think she'll bring her passion on these issues to that, and that might create opportunities for some shared work. And also talked about, having Accelerator cover not just city but also state contracts. A question in the chat room also about, are these scalable across jurisdictions? I think, it seems to me that it's the technology is not the challenge. It's the bureaucracies and the legal structures. And I think it would, part of the sort of the map of the world I see in front of us is one where we actually do have a federation of data across city and states. I think about, all these crazy hoops that people jump through in the child welfare system in particular, just to keep track of kids and make sure they're safe, and there's just endless examples where the ability to integrate across jurisdictions is a matter of making the commitment to do it, and it's not a technology barrier at all.
This is Uma. For us as well, when by amendment, when the General Assembly in 1994 created an integrated health and human services department, created the framework for this level of integration to occur. But it's a long time because of the funding silos and the programmatic silos to really towards a better braiding. I don't think we can use the word to blend anything, because then people are always worried the stream would lose its integrity, if you will. So we've been able to do a lot at the county level, because in essence we look like a block granted jurisdiction, which is not the norm in the state of Maryland, and we've been able to create and force the integration from that perspective. We would have definitely liked to receive some additional funding, through the 87 letter, but we're not a state, we're a county, and so unless the state's moving in the same direction or can reuse their approaches and our methodology, that we're continuously to build alignment with the state, so we're not running counter to what the state is trying to do. But as long as we're still complying with all of the state's regulations and requirements for the funding that we do get, we have a reasonable amount of flexibility to do what we need to do locally, and so that's helpful. So there's a whole lot of mud in the eye, but we just completely integrated all of our eligibility systems, including, with Johnson eligibility, and it involved sort of doing two state departments programs and moving positions and doing that kind of stuff, and we're able to report within the silos that the state departments care about. It's been relatively seamless and very advantageous at the local level.
Anita?
I think I'll just respond to one of the questions that are in the chat room on the generative business model, if I could. We had some, I'll name two counties in Minnesota who have done quite a bit of work using the Human Services Value Curve and the self-assessment tool. One county, Olmsted County, has used Human Services Value Curve with Board of Supervisors to justify for themselves and for the decision makers in that county about where they want to be and how they want to serve clients, and that the definition of that journey was great, and their feedback with the director there from the board and other agencies within that county, that particular framework really made a lot of sense, and folks were happy to be able to see how it could be used. And another county in Minnesota, Dakota County, they have also used the self-assessment tool to drive their own strategic plan, and they have really been changing their business processes to look at how they can be at a generative level within their community, and I'm sure either one of the directors would be happy to talk with anybody about their use.
We've here been involved. We have a program called Data Smart Cities, and we've been looking at the use of predictive analytics to anticipate circumstances which may be in future harm, predict what types of providers are best with what types of children, just to reorganize the resources. So this is now emerging, and obviously the data that we've talked about today is a predicate to that. But if you have examples of moving from electronic records to using algorithms against the data to figure work based on predictive analytics?
Sadly, with Connect, the answer at this point is no. And part of it goes back to the way that it was built. What it is it's a kind of synapse that gets fired on a search, provides information, and then disappears. So it allows you at a worker level to get a point in time view, but it doesn't centralize or store that information. And so it would have to be built differently in order to get the kind of historic information you need in order to do predictive analytics. What we've done in parallel through our CIDI, the Center for the, I don't even know what CIDI stands for, Integration of Data Intelligence or something, I don't know, it's really great. CIDI is a parallel process that essentially takes the repository of agency information, benefits from all of the confidentiality research that's been done, and create a historic database that gets refreshed routinely, exists for the purpose of doing those kind of analyses, but that's not Connect.
For us, we're just building our system. We certainly plan on attention to analytics, but otherwise, but we're not there yet.
Okay. Counties around the country starting to think about this, like Allegheny County as well. So it'll be an emerging area.
Yeah.
Well, let's look at the last few minutes if we've got one question. Jessica, when will the presentations be available?
Yes, they'll be available in a few days, early next week, and everyone who's registered will get an email when the presentations and the event recording are ready.
Just in closing, ask each speaker to kind of address their comments to the question raised by Rick Powers. There's kind of no wrong door, which we often hear about now. Is door, or is it just you come in any of the doors and are able to get to the first-tier case management task? And then also when you answer the question, just one or two thoughts. I think these are different questions, but how do you manage to overcome the resistance that's kind of endemic in these systems where really very real and can harm a lot of folks, both the clients and the workers. So just go down the line. Linda, your closing statement, including addressing those two, and then Uma and Anita.
This is a really big, tough obstacle, and I think that in many ways I see Connect and Accelerator as very much a tip of the iceberg type of IT change, and most of the benefit is still in front of us. We're sort of cracking the how do you take those first baby steps, but I think the potential is huge, and it's still in front of us, and it will confront increasingly the challenges about changing business practices and dealing with the sort of all the, both the owners and operators and lovers of our, sort of legacy IT systems and legacy business processes. And so for instance, while many of our interfaces should require face-to-face contact and very clear, crisis management or accountability management. In many cases, these services don't need a real, what they need is a person in need to most quickly get to the service with as little effort as possible. So, and with the HRA virtual office application, in fact, that is the goal: eliminate office visits and face-to-face contacts where they're not required. What that is going to mean, and we saw this in our Medicaid the reapplication, the renewals of the Medicaid eligibility, where the workforce said, people aren't going to be able to do this. They need us. They need to come and have us. They're not going to be able to navigate on their own, or they don't have connectivity. And so there were a million reasons why something that ought to have been done online needed to be done in purpose. And so overcoming that resistance and dealing with the real human consequences of that. There will be many jobs that, as a result of the technology, will not be needed in the same way. And in the human services world, there are plenty of unmet needs, and reallocating those resources to more productive uses and training the workforce toward those uses, both getting people on board and being smart enough about how to get there is a big challenge. And so, I think that part of this is really continuing, refreshing those strategic plans, not just saying, sort of dusting our hands off and saying, phew, we're done, because even with these systems, we remain at both the initial stages in human services, and quite frankly, still a little primitive in terms of what IT can bring to bear in improving services.
From our perspective in Montgomery County, we actually did a single large door. We created a more virtual, the wrong door, so it didn't matter which door people were coming in through. They had to complete the same face sheet, and the same screening tool was applied with the same scoring methodology, and we were training our folks in such a triage approach to the scoring tool to make sure that they were facilitating the tool appropriately. And from a change management perspective, for us, it's still a work in progress. It helps when you can actually demonstrate that you have the funding to create the technology, because people are very skeptical at the moment in time. Are there people who are resisting? Absolutely. I mean, I can't tell you times we've revisited data sharing protocols in principle, and every time we try to take it from the behavioral health implementation of electronic health record to talk about dental, that whole sort of box kind of gets reopened, right? And all the genies go and start doing their mischief again. And sort of an ongoing process. Communication is key, making people feel valued and connected and engaged. And everybody has sort of a different set of fears about what integration or interoperability will mean. They also have a set of expectations around the opportunities it can bring, and continuously revisiting those, reframing those. I don't think you're ever done in that change management process. We do believe that there will be a level of retirements that will happen as the system goes live, and significant realignments with the business process. The I would say is, as we're shifting our business processes, and as the recession is ending and there is a new normal, we're now preparing to have a very fundamental resource alignment conversation, because the way we were resourced, and in most experience-based budgets, that's how it goes, right? The way we were resourced 3 or 4 years ago may not be the way we need to be resourced 2 years from now. And so knowing how to make those shifts it take a lot of give and take even within our integrated system, where we believe there's a lot of trust and leadership. So something to brace for. Because it is clear that when you implement technology, there have got to be the efficiencies that get translated in some way into positions or dollars. And if you cannot make a case, and for us, the biggest case is moving the resources upstream, because we want to become more efficient right at the front door where people are coming in, to make sure that we're wrapping around them so they don't penetrate.
So just a real final point. Yes, I agree with everything that Linda and Uma have said about the communications piece and involving the workforce in the change process, and the importance of really honing in on the decisions that are made to make them truly client and person and family centered, and do that by involving them in the change process itself. And there are organizations, human service organizations across this country, that do a really good job of involving clients in that decision-making process, in addition to the workforce, in addition to the leadership of the organization. And when that happens, the change that actually takes place looks far different than it does when clients are not involved in that process. And then just a final note, APA really focuses in on being very systemic in addressing integration changes that need to be made, and our approach to working with our state and local leaders is just that, to have a systemic lens. And then the piece around project management and change management and business process reengineering and all of those different techniques that are important to implement a technology solution really has to be done in a very systematic way, and a very structured and organized way. So those two words, being systemic and systematic in the work that needs to be done, I think highlights what both Uma and Linda have described today. So thank you very much for having us on.
Thanks for your comments. Sam, why don't you close with any observations about how the presentations reflected or amplified on your report, would you please?
Yeah, I won't. I know I won't take up too much time. I mean, I thought that this was a really fantastic conversation. I think that a lot of what Linda, Uma, and Anita lifted up is really consistent with a lot of what we heard, which is, one, you really have to have a clear sense of the challenge that you're trying to solve. Two, that the business process that you're trying to change or intervene and improve is as or more important than the technology process that you're going to layer onto that. And third, that it's really a toolkit. It's not any one hammer or screwdriver that you're going to use in order to implement these tools effectively, either at the agency level or out with the population that you're working with. That's something we heard from a lot of different sites. So, that alone is, of course, not a recipe to pulling off these projects successfully, but what we hope is that this conversation, along with the report, is going to help provide people with a lot of useful input as they begin to think about some of the really important projects that they can undertake. So thank you very much.
This is Jessica Engelman at the Ash Center, and I just want to thank everybody for their participation today, and this will conclude our call. Time.